wellness revolution starts now.
Welcome to the show. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And if you've been told by your doctor, maybe multiple doctors, that your symptoms are all in your head, then this is the episode for you. And I want to be sure that you stick around with us until the end because there is a lot that you're going to want to hear. And today, the purpose of this episode is to cover an overview of mast cells. We're going to be talking about mast cell activation syndrome, which you may have heard of. There's kind of some buzz around it right now. So I want to start off by talking about what mast cells are, their role in the body, what happens when they become overactivated, and why that's a problem. And also some of the compounded prescriptions, of course, that we can offer you from Physicians Preference Pharmacy to help get you out of that tailspin of symptoms. So first of all, what are mast cells? Mast cells are actually white blood cells. So they're a really important part of our immune system. So it's something that we always have circulating around in our body. And in fact, mast cells are present in virtually every single tissue within the body. So you can imagine just how important these guys are. They're found densely in the GI tract, in the lungs, the skin, the eyes, which is why we tend to have a lot of symptoms a lot of issues and symptoms in those areas when we have mast cell activation syndrome. So part of the role of the mast cells are to actually keep us alive, to produce allergic reactions in a good way, to keep our body safe. The mast cells are circulating around the body 24/7, basically asking one question: am I safe? And if they perceive some sort of threat, whether that's an exposure to an environmental toxin or a virus or a bacteria, then it goes into action. So it creates inflammation essentially, which is good until it's not. If inflammation doesn't turn off, and if this mast cell activation doesn't turn off, that's when we begin to have a problem. So several different systems within the body are affected when mast cells are overactivated, especially the GI tract, again, the skin, the eyes, the lungs, the central nervous system. This is why a lot of times patients that have mast cell activation syndrome have gone undiagnosed and or been told by their physician, it's all in your head. Part of getting older. This is just what you're going to have to deal with. Oh, and by the way, I have a diagnosis for you, but not an answer. So part of what I want to talk about today is debunking that, empowering you with understanding what these symptoms are so that you feel equipped to go to your physician and talk to them about that. So let's talk about what mast cells interact with, because this is a really important part of how we address the symptoms of mast cell overactivation. So everything that we eat, everything that we breathe, everything that we swallow, if we are exposed to injury or trauma, if our hormones are out of balance, any supplements, medications that we take, even invisible energy like EMF and Wi-Fi, all of these things have an impact on our mast cells. So we have to be sure that we're protecting the mast cell function. So mast cell activation syndrome, or MCAS for short, is a syndrome or a collection of symptoms where the mast cells are constantly being overactivated, they're hypervigilant, or they're overactive. Now, roughly 17% of the population is actually affected by MCAS. Around 37% we think of obese individuals are as well. And MCAS is chronic, so it's something that steps up continually each time that you're exposed to a stressor, injury, trauma. MCAS baseline steps up. So what does that mean? It becomes very difficult to treat. And usually this is why you will hop doctor to doctor to doctor before you get any kind of answer at all. So let's talk about some of the common root causes that we see in MCAS. One would be food triggers. So it includes high histamine foods, but not just high histamine foods. Infections and toxicity. This includes mold, viruses, bacteria, genetic factors, which impact how well our body detoxes or responds to inflammation. Nutritional deficiencies, which is kind of a catch-22, because if you're that person that is so sensitive to so many different types of foods, In fact, many MCAS patients I speak with, their food list is limited to maybe 4 or 5 foods that they could tolerate. So how are you supposed to nourish your body and strengthen your gut and diversify your microbiome if your list is only 4 to 5 foods? It's catch-22. That's why we have to interject, stop the tailspin, decrease inflammation, calm those mast cells down so we can heal the gut, because we know the gut is functional to overall healing. Also, lack of oxygen to the tissues, hormone imbalances, a huge focus for us. So we know that the mast cells, this immune cell that's so crucial, and hormones have a very intimate relationship. In fact, one of the things that's interesting about mast cells is they're very interactive. So this one little cell has over 200 different types of binding sites on it, which means that it interacts with at least 200 other things in the body. So again, it makes it very interactive and reactive. One of those things is hormones, particularly estrogen. So we really focus a lot, especially in women who are going through transitions in life, whether that's pregnancy, perimenopause, menopause itself, or navigating postmenopausal symptoms. What do we do about estrogen? How do we bring progesterone back into balance? So this is a big focus of what we approach our MCAS patients with, to be sure that we can bring their hormones back into balance and calm some of these symptoms that patients with MCAS experience. So there are a few symptoms that I want to outline to you. This episode might be a little bit different in that we will focus clinically on what the symptoms are, because again, usually someone that's eventually diagnosed with MCAS has been bounced around doctor to doctor to doctor. And rather than you seeing 15 doctors, if you've already seen 2 or 3, then I'd rather just stop it there, empower you to know how to actually identify some of these symptoms, again, so you feel equipped when you go to your physician to ask how to get resolution of these symptoms. We want to open up the conversation around MCAS. So we have integumentary findings, which essentially the integumentary system is hair, skin, nails. And usually those with MCAS will show up with brittle hair. There will be cycles of thinning and loss. We're hearing a lot about this over the past few years, so that probably sounds familiar to you if you're not experiencing it yourself. Brittle nails, ridges in the nails, also small white spots on the nails. Sun intolerance. So we're talking about sun intolerance on the skin. And I'm not talking about being fair complected and burning easily. I'm talking about you're going outside, not in the excess heat, but when you come back and you feel like your skin is on fire, like it's burning. Now you've developed a rash and you feel so chronically fatigued just from being exposed to the sun, something that should energize you and give you vitamin D, right? It sounds like a good thing. That's a cue to us something's going on at an underlying level. What about findings in the eyes? It's very common for those with MCAS to say, my eyes just always feel like they're gritty or there's sand in them or they're burning. There's over 50 million mast cells in our eyes alone. So again, very interactive with the outside environment. So we can't help that we constantly have to expose our eyes to the environment around us. So we need to be sure that we're calming the mast cells, and we're going to talk about some tools of how we can do that. What about the ears? We're hearing about a lot more tinnitus or tinnitus, that ringing in the ears. And part of what happens there is there's a lot of mast cells present in the ear canals, near the nerves, near the blood vessels. And so when we get inflammation in the ears, it starts to cause even some vertigo maybe, or some ringing in the ears, because it throws off our inner ear, which is all based on balance. So inflammation is a big driver for this, uncontrolled inflammation. Nasal findings probably seems pretty obvious. You cannot say mast cell activation or have that conversation without talking about allergies or sinus infections. So when we think about mast cell activation syndrome, we really are thinking a lot about the sinuses as well. We're talking about runny noses. We're talking about constant postnasal drip. We're talking about idiopathic bloody noses, which means we don't know why it happened. It's just a random bloody nose. One of the reasons that happens, again, is because of inflammation in the tip of the nose, which is has a very dense network of blood vessels. So when we get inflammation there, it can cause a bloody nose. Now, what about in the mouth? It's very common for those with mast cell activation syndrome to have teeth that crumble prematurely, and this is even despite great oral hygiene. Burning mouth syndrome, which happens because there's a release of those mast cells and inflammation in the oral tissue, or there's inflammation that makes the nerves inside the mouth overreact and perceive pain. So something referred to as burning mouth syndrome is usually happening primarily on the tip of the tongue. Feels like it's literally on fire, followed by the lateral tongue and also the cheeks. Very common in women surrounding the time of menopausal change within about 12 years on either side. So we know for that reason, again, it's hormonally linked. Respiratory findings. I just cannot seem to catch a deep breath. That's a very common comment from someone with mast cell activation syndrome. The lungs have a very dense network of mast cells present. So whenever we have bronchodilation, bronchoconstriction, bronchospasms, think about those people that are reliant on inhalers, one or multiple inhalers. That's mast cell overactivation happening. So we really want to be able to tamp that down if we can without reliance on inhalers. Lymphatic findings. So the lymphatic system is basically the sewage highway of the body. Not necessarily to move out stool per se in the sense of sewage, but what we're talking about is it's the toxin highway. We want to eliminate toxins from the body. So the lymphatic system is its own enclosed system, but again, it's very interactive. So it's very interactive with the cardiovascular system, with the other detoxification organs like the liver and the spleen, for example. It pulls out toxins. But those with mast cell activation syndrome will find that they usually have chronic fatigue syndrome, a lot of malaise. Sometimes they'll be laid up in bed. Even the slightest movement or doing much more than just walking around will make them very sick. Why? Because when we get moving, when we get sweating, that actually mobilizes what's going on in the lymphatic system to get it out of the body. But if it pulls it out and puts it in the blood, then it's kind of like dumping those toxins or trash, for lack of a better word, because it's really what it is. It's metabolic byproducts into the blood. That makes us feel very bad if that system is stagnant. So we have to be very gentle in the way that we detoxify the lymphatic system in those with mast cell activation syndrome. And I think that this is where a lot of physicians are missing the mark. Neurological findings. Now, I say this because, unfortunately, I've heard over and over again from those with MCAS diagnoses, I've had so many physicians tell me it's all in my head. They don't believe me. My physician is not listening to me. They don't even know how to diagnose this. So that's why we're having this conversation today. I want you to know these symptoms are not all in your head. They're very real. In fact, one of the reasons why you're probably hearing physicians say that is because they don't understand that mast cells are so densely present in the central nervous system, in the brain. One of the main reasons, if not the number one reason, why people who have had repetitive COVID infections continue to have what we refer to as COVID brain or brain fog is because the mast cells, those immune cells we're talking about in the brain, are overactivated, causing inflammation, which we cannot have an inflamed brain and have clear thoughts. So until we get those mast cells under control, that brain fog will continue to ensue. This is a large part of why we have chronic fatigue associated with mast cell activation syndrome as well. So something I want to cover that is very intimately related with the mast cells and how the mast cells function is histamine. So let's talk about what histamine is and why actually it can cause a problem when we're talking about mast cell activation syndrome. So histamine is something that our body naturally makes. Now, if I could show you a picture of a mast cell, what it would look like is this cell with a bunch of little sacs in it. And in each of those little sacs are contents that are released when that mast cell says, oh, I have been exposed to a toxin or a bacteria or a virus or stress. I need to release what's in those little sacs, send out the messengers throughout the body and heal, heal, heal. So one of those little mediators or chemical messengers that mast cells dump out into the system is histamine. Okay, so when we think of histamine, we usually think of antihistamine medications, Benadryl, something like that. Histamine has some really important roles in the body. So it actually participates in the inflammatory process. It helps to open up the vessels when we need blood flow to heal. It releases hydrochloric acid in the stomach to assist in digestion, and it functions as a chemical messenger to the brain. So, not a problem until we have histamine overload, which we refer to as histamine intolerance. So, when we think about a bucket, this is the analogy that we use with histamine intolerance. You've got a bucket with 2 holes at the bottom. Those 2 holes at the bottom are 2 very important enzymes that help to detoxify the body and release histamine from the body. But if those holes are plugged up and you're just pouring all of this histamine in the bucket all day long, you will be at your max at the end of the day. Here are some things that contribute to histamine intolerance or raising histamine levels in the body. Hormones, an inappropriate diet, toxic environment, medications, allergies, gut bacteria, nutritional deficiencies, high histamine foods, and last but not least, everybody's favorite, stress. So if we don't take measures through lifestyle changes, appropriate supplementation, a variety in our diet, we're going to have very high histamine levels. One of the very most common complaints that I get from patients is, I cannot sleep. And when I ask them about what they're doing throughout their day, I can identify most typically several choices, either in diet, lifestyle, that are increasing their overall histamine load. And in fact, your histamine load naturally increases throughout the day anyway, so it's at an all-time high when you're ready to lay your head down on your pillow. But guess what? Remember, histamine is a chemical messenger to the brain to excite the neurons in the brain. So we have to be sure that we're keeping that at a level balance. We are keeping our hormones in balance, and we are also nourishing the gut. So, of course, as a pharmacist, I want to talk to you about some of the compounds that we have available at Physician's Preference Pharmacy to address some of these symptoms that we've talked about. I want to be clear. The goal here is not to medicate, to put a Band-Aid on the symptoms we've addressed. What we want to do is we want to get you out of the tailspin of those symptoms, calm the mast cells down so that the immune system can then just begin to do its work and keep you safe and protect you. So please hear me when I say this, that when you're choosing compounded prescriptions for treatment in MCAS, first of all, you want to be sure you're choosing something that's compounded because we can adjust the dose, we can adjust the dosage form, we can adjust the inactive ingredients that go in there, which is going to be your number one concern with any medications or any supplements, or what are your inactive ingredients. Ask your pharmacist. Ask your pharmacist about using the appropriate fillers that are not going to aggravate your mast cells. You always want less inactive ingredients in the product if you can. And then also you want to choose veggie capsules. So other types of capsules that have dyes in them, tablets that have dyes in them, inactive ingredients, artificial colors, cornstarch. No, we don't want any of that. And our products do not have that. And they're designed specifically for mast cell activation syndrome patients with very inert, inactive ingredients as well. So want to run through a few that we have options for. I have taken several of these myself when I catch myself in a tailspin of my mast cells being overactivated because I have been there. First and foremost, antihistamines. So makes sense. We talked about histamine. So antihistamine means that we're helping to decrease the release of histamine from those mast cells. So we want to be sure that we're using different products to stop or block the function of H1 and H2 receptors, which are different type of histamine receptors in the body. We have different products like loratadine, famotidine, the equivalent of Benadryl. And you'll notice, if you look at our formulary, you call the pharmacy and you ask about dosing, our doses are very different. So your typical over-the-counter Benadryl is a 25 milligram tablet. You can usually take 1 or 2, depending on the age, what you're using it for, tolerance, etc. Our product is 60 milligrams, for example, but it's a slow release product. So you can take several of these throughout the day and not feel drowsy. For example, I can barely tolerate 1 immediate release 25 milligram Benadryl. But when I have been in situations of mast cell overactivation, I've used 2 or 3 of these 60 milligram Benadryls throughout the day that are compounded without any drowsiness. You'll notice that the dosing with mast cell activation syndrome patients is what I refer to as vertical. So there's not a lot of tolerance across the board of foods, nutritional supplements, or medications. So when we find something that works, we want to be sure that we're growing in the dose and maximizing our use of that first before choosing something else. Rapamycin, or sirolimus, is a great promoter of what we call cellular autophagy or cellular detox. We talked about the lymphatic system and kind of that buildup of cellular toxins. So sirolimus helps to offload that. One of the things it also helps with in mast cell activation syndrome is bowel regularity and quantity. A lot of times constipation is a major issue, so this can assist with that. We focused on hormones. We really want to be sure we're bringing progesterone and estrogen into balance so that we're not further aggravating the mast cells. Again, choose capsules, choose them in a veggie cap. Also, low-dose naltrexone is a wonderful mast cell stabilizer. It's a great anti-inflammatory regulator of the immune system. We use it a lot in long COVID. It really helps with that brain fog as well. And then probably my personal favorite now, because I take it myself currently, is Amlexinox. So Amlexinox is also a mast cell stabilizer. It improves, we've seen this clinically, that it can help to improve hives, eczema, rashes, bronchospasms, so that vibration of the lung tissue. It also regulates the immune system. And I think you really get the most bang for your buck with Amlexinox because none of these break the bank, but a lot of times you'll need several different products. So if we can choose one product that has several different uses, we love that. It's price conscious. We've seen improvement in flushing, headaches, allergic rhinitis, asthma, abdominal pain, and itching. And I just want to share with you that we had one guest in particular that, condensing her story down essentially, she initially came to us on 81 different medications and supplements combined when I was reviewing her med list. So I was able to go through with her and slim some of this down. We started her on Amlexinox per prescription by her provider and brought her down to just 17 products. So that's huge, not just for the overload on her body, but also for her pocketbook, right? So where to start in MCAS as we wrap up? Find yourself a physician who listens, who understands the complexity of the mast cells, but also that mast cells aren't the bad guys. We just have to calm them down, stabilize them, and support them. Get your hormones in balance. This is a non-negotiable. Choose clean compounded prescriptions and supplements which do not have bothersome ingredients. And this is what you should look out for and that you want to avoid in those products. Artificial colors, flavoring, cornstarch, dyes, potassium sorbate, sodium benzoate, talc, titanium dioxide is a big one, and probably the biggest, magnesium stearate, which is in just about everything. It's not a bad ingredient, but it tends to be very bothersome to the mast cells. So watch out for that. Get clear on your triggers. Be sure that you're avoiding them, environmental or food triggers. And then again, calm the mast cells. That's really the whole take-home point of what we're trying to address with compounded prescription products. Remember, please, that the recovery process takes time. You didn't get here overnight. You're not going to heal overnight. But that's why it's crucial to surround yourself by a healthcare team who understands what's going on, who can have sympathy for where you are right now, and also really support you in achieving the common goals. Now, of course, pharmacists are a crucial part of that healthcare team. So if you have any questions about mast cell activation syndrome, about any of the compounds that I spoke about today, please give us a call at Physicians Preference Pharmacy to speak with any pharmacist. You can reach us at 281-828-9088, or you can go to physicianspreferencerx.com, and it would be our privilege to serve you. If this episode resonates with you or a friend or a family member that you know you should be sharing it with, please do share this, and we cannot wait to speak with you soon. Physicians Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.